Well, in my view, it's really recruiting and retaining the young endocrinologist to get into our specialty and empowering those individuals. There are a number of challenges that affect these individuals. The amount of grant support has gone down in recent years, and that's a major component of our practice. It affects both basic scientists, clinical scientists. It's estimated that in the next 10 years, something like 80% of physicians will be hired by hospital systems and not in private practice. And that creates all of the time pressure, what we call RVUs, relative value units, but physicians' time is really got to be directed more to getting the job done, which means that less time for discussing issues with patients, less time with forming a relationship, which is so key to being an excellent physician. Only 10% of patients with diabetes are taken care of by endocrinologists. And so the patients that have more difficult controlled diabetes are taken care of by the endocrinologist. But we've got to develop some more efficient ways of doing this. And there are now cell phones that hooked up to meters, which are hooked up to a computer. So a physician basically can get the entire picture in a minute, where it used to take 20 or 30 minutes. And that's where the endocrinologists are really leaders in finding out really how to deliver better care, but more efficiently. Well, we always ask ourselves that, and I think that the buzzword right now is called precision medicine. Now, what's a good example of that? At this meeting, Dr. James Ingle, who was the plenary speaker, had found a mutation in women where the DNA suddenly became responsive to estrogen. Wasn't before, and in the absence of estrogen, women had severe joint pain. And if you gave them estrogen, it would relieve this. Now, only perhaps 20% of women would respond to this, but if you measure this gene and find this is then a precise way of taking care of patients. So that's precision medicine. Personalized medicine is a little different. And if I have a woman that's just gone through the menopause, I want to know what her risk of heart disease is, what her risk of breast cancer is, what her risk of a fracture is, what the risk of getting a blood clot in the leg. And with that, you can balance the benefits of being on hormone therapy versus the risks. And that's what Joanne Manson talked about at the plenary. So it's a combination of personalized medicine and precision medicine, and in time you can see the two will become the same. There are a number of advances in care of our patients, and this is the place where practicing physicians learn about that. Probably one of the areas for diabetes is called continuous glucose monitoring. So if you have type 1 diabetes, your blood sugar fluctuates quite a lot, and you cannot ask a patient to stick their finger 12 times a day to see what's going on. So this continuous glucose monitoring gives you an idea of the pattern throughout the day. This then goes onto a computer and is presented to you as a graph. So where do you get that kind of information out to a practicing physician who takes care of diabetes patients? It's done here, it's done by an expert, and that expert tells you where we are, but also tells you where we're going in the next year or two.